Chairperson. The ANC keeps touting the NHI as being the best interest of South African citizens, that it is a bill born out of care that will save the public health system. So let us take an honest look at what the implementation of NHI Bill will mean for the ordinary South African. Now, about 9 million people have medical aids. Once the NHI is implemented, the 9 million people who have to be accommodated on an already overburdened public health system. Instead of going directly to the privately paid doctors and hospitals, they will now be competing for treatment in the public health system with its severe staff and resource constraints. The last indicators of the national surgery backlog was more than 168,000 cases. The ANC might argue that through the NHI fund, private health facilities will be servicing a larger portion of the public previously unable to access their services. However, this is based on the ludicrous assumption that those 9 million South Africans would continue to pay their medical aids when it will have no longer benefit for any of them. Without private patient funding, private health facilities would be dependent on government funds, effectively making them public health facilities without the benefit of a dedicated budget. As governments has done no feasibility studies, we do not know how many facilities would survive government's imposed fee structures. These potential closures would further decimate the health sector. In addition, talking of a decimated sector, staff shortages are a massive problem and have been for years. Not only are public health personnel expected to work in horrendous and unsafe conditions and facilities where the provisions of quality health care is nearly impossible. They are victimized when they speak out in an effort to address their concerns. There will surely be a mass exodus of medical professionals if the NHI is enforced. How has government addressed these shortages? Not by accrediting private health sector to train their full capacity of nurses. Has government upgraded their health facilities and ensured that hospitals and clinics are safe? Have working equipment, enough beds, medicine and food? The DA and committee's oversights, AG reports, patient feedbacks, or whistleblowers attest that many of the country's hospitals and clinics border on inhumane conditions. To this day, we do not know which services the NHI will cover. Will the department pay for hip replacements, dental care, appendix removals, dialysis, chemotherapy, TB, and HIV treatment, or mental health care? We do not know because you have refused to inform us, possibly because you don't know, but possibly the biggest reason why the NHI will inevitably destroy all healthcare in South Africa. The ANC cannot be trusted. Corruption has become more natural than breathing to you. During a worldwide pandemic that saw more than 102,000 South Africans die and had millions confined to their houses in fear, the ANC government facilitated the looting of 2.1 billion rand that was meant to treat coronavirus and intervene in a variety of ways. Not something a government that cares for the poor and the vulnerable would have done. The DA has always believed in collaborating with the private sector for the whole of society approach in addressing the issues plaguing society, instead of scapegoating them for governance failures. Despite the ANC's best attempts to create the impression that the private health sector is to blame for the public sector's deficiencies, it is government's mismanagement, cadre deployment, and corruption that has caused and now immortalized the destruction. The key is to ensure that patrons of the public and the private health sector both receive quality health care. After all, The expansion of private healthcare sector is a consequence of the failing public health sector, not the cause. As such, conditions must be created that will encourage private investment in the public health sector. Your determination to alienate or absorb the private health system will end in tears. Corruption must be rooted out, and provinces need to have greater accountability where health outcomes are poor. Do not sell a dream to people. When you misdiagnose the problem, you will not find the correct cure. The cure is proper financial management and zero tolerance to corruption. However, that cannot be done until people like the former health minister is held accountable. The NHI is not the miracle the ANC purports it to be. It is smoke and mirrors meant to make voters believe that the grotesque looters standing in front of them have
Honourable Member, your time is now expired. Thank you.
that once liberated a nation. They have not and they never will. We will not support this bill.